Okay, so what is your name?
My name is Megan Lott.
Okay. What is your degree in?
I have a bachelor's in social work
Okay.
from Missouri Western State University.
So what type of social work positions have you had since obtaining your degree?
Yes, I originally worked for a youth program right out of school, and we serviced Leavenworth, Johnson County, and Wyandotte counties. And essentially is what we did is, it was a grant-funded program, and we taught middle school and high school age students job skills. And then from there is what we would do is we had contracts with businesses in those 3 counties, and then the company in the grant would pay those kids to do job skills. Most of those kids were on probation and parole.
Okay.
And so, with that being said, we were trying to help them find a trade or something that they thought that they could be successful at after they graduated from high school.
Okay.
So, and then I worked at a skilled facility for just a short time. I had done my practicum there, and so they had asked me to come back. That grant program actually no longer existed, so the timing worked out good for my professional career. And then I wasn't looking for a position, and Mosaic Life Care was like, hey, we have a position open, we'd be interested. And with that brought a whole bunch of different experiences. So I've kind of worked everywhere in the hospital, so OB, pediatrics, women's health, orthopedic, ICU, cardiac, so kind of all over the hospital. And then now currently, then I worked at the cancer center for a couple years, and then now I currently work in home health for home services.
So what does a day look like in your world right now?
Sure. Currently I schedule my own patients. So I typically get a referral, and then I make contact with the patient within 24 hours. And then from there, I schedule patients usually Monday through Friday, 8 to 4:30. And then sometimes people cancel or aren't feeling well, things come up, things like that. So it's just being flexible and just kind of readjusting to whatever the patient needs.
So this probably kind of falls in, but like, how do clients get referred to you?
Sure. So we have an admission nurse that goes out and sees the patients. Typically, home health patients are referred through a physician's office. The hospital is pretty much our main referral source. And then from there is what we do is when the admission nurse sees the patient, then that's when they make the referral back to the social worker. And then, like I said, I schedule my own visits and then go see people based off what their needs are.
What are the main services you provide a client?
I would say my main goal as a social worker, it's a different setting being in the home than in the hospital. So you really meet people where they're at. So, if you're in a clinic or you're at the hospital, sometimes people will say that they have what they need. But in the home, you see a different picture. I'm sorry, I forgot your question. What
are the main services you provide a client?
Okay, sorry. So then, essentially, we meet the patient where they're at. And the main goal is just to make sure they have what they need to be successful in their home. So whether that's, or wherever we see them, assisted living or whatnot. So that's the main goal, is just to make sure that they have what they need to be successful in their own environment.
Is there a time limit on the amount of time you can serve your clients?
So with home health services, typically we certify patients for 90 days. When I do that first initial assessment with the patient, if we feel like they need an additional visit, what we do is we set some goals, and then based on if we're meeting those goals and how soon we achieve them, determines how quickly whether or not I'll discharge a patient or not. So typically I would say probably a lot of people we can get things done in one visit, but sometimes it's 2 to 3 visits per patient.
Do you interact with the community in your job? If so, what does that look like?
Absolutely. With Mosaic, we're very community focused, I would say. So we do a lot of events outside of the walls that we work in. And I think a lot of times it's encouraged, within our organization to do those community type things outside of work, whether it's at the food bank or, home health and home services do organize events for the community members. We just did a food drive and some things like that. And I definitely would say that being a social worker, taking an active part in that, it's just good to expand your horizons based off, just your normal day-to-day work.
What is the best thing about being a social worker?
I think a lot of times people think that social work is a demanding job. They don't really see it as a rewarding job. And I think a lot of times at the end of the day, sometimes you do have to go back and focus on who you helped, because it's not always pleasant, and the people that you interact with aren't always the nicest. But if you remember at the end of the day that they are ill and that there's a reason that we're seeing them, and you do meet a ton of incredible people as well. And I think it's just nice to know that we service our community and the outlying communities that we are in. And I think that in itself is rewarding. And it's also nice when patients, complete their patient satisfaction surveys and just give comments just in general about home health and how maybe you helped them in a time that was really desperate for them. So,
is there anything that you would like as a social worker to be better?
I think sometimes we lack in further education. I think sometimes like conferences and just, I'm the only social worker for home health, so sometimes you feel a little bit alone. And I know other agencies is the same way, but it is nice that we do have all of home services to coordinate and to correspond care with, so that is nice, and the fact that there are social workers in those avenues. But sometimes I think we forget, we get so just in a daily routine, and so, I gotta get this work done, and I got people to take care of, and I need to get things done. And so sometimes I think we forget to talk to other people and use what resources they know, and just to kind of, have an extra base for our patient population that we service.
For future social workers, what are the best characteristics you feel they should exhibit to be successful?
I definitely think compassion, humor. I think a lot of times social workers, people would not usually think some things are funny that we make jokes out of, but you just sometimes have to do that to get yourself through your day. I definitely think kindness, and just knowing that the people that we do serve a lot of times are in a vulnerable place, and that they really do need our support, and really just to meet people where they are. I think when you work in a hospital or in a clinic or in a cancer center, a lot of times it's easy just to see people as people, and we don't see them for who they really are. Mm-hmm. Whereas when you actually go into their home, we really see everything that they live on a daily basis, whether that's blankets stapled to their windows because they don't have a window. So I think really just physically putting yourself where they've been, even though maybe we can't 100% relate to that, just thinking, if I lived here, how would I want to be treated? What resources would I want if I was this patient? And just really trying to make sure that you provide the best and safest care to the patient that we serve. I think communication skills are very key, very important in being a social worker. People want to feel communicated to, and I think just in corporate America in general, a lot of times people think that we don't communicate enough, even though sometimes we're sending emails and phone calls and all that kind of stuff. So I would say that's probably the main ones I would say.
Well, thank you.
Absolutely.